Hey, are you taking too many prescription medicines? In this video, I'm going to be talking about polypharmacy, why it's a problem in MS, and what we can do to fix it. Don't turn away, because all of that starts right now. Howdy! Thanks for learning about MS with me, Aaron Boster. In this video, I want to tackle the topic of polypharmacy. That's a doctor word for, Lord God, man, you're on way too many medicines. There's actually a definition of being on more than 5 medicines a day that would be described as polypharmacy. And unfortunately, in the setting of MS, it's rampant. Many patients are on more than 5 medicines. In fact, in the United States, the average person with MS takes 7. Now, I want to spend some time today talking about why that is and what we can do to fix it. So let's jump in. For starters, let's talk about why you should even care. What's the concern about being on too many medicines? Well, there's really 2 concerns. The first is drug-drug interactions. So sometimes you may start a medicine and then that medicine will have an impact or effect on one that you're already on. Medicine A might make medicines B dose go up or go down in your body, which obviously affects the success of that therapy. And so the more drugs you're on, the more chance for drug-drug interactions. The second is cumulative side effects and adverse events. So for example, many medicines that we use to treat multiple sclerosis symptoms have a side effect of fatigue. Many of the drugs that we use to treat MS symptoms have a side effect of cog fog. These are major symptoms in MS to begin with. And so you're adding insult to injury by stacking on too many medicines. So why exactly is there a polypharmacy problem in the setting of MS? Doctors with good intentions want to help patients live their very best life. And as an allopathic doctor, one of the major ways that we try to do that is with lotions and potions. And when you are helping someone impacted by MS, there's a lot of stuff that you might need to work on. So let me give you an example. I want my patients to be on an MS disease modifying therapy. I also want them to supplement their vitamin D. I'm very keen on addressing the up there's, energy, mood, thinking, and memory. And it's a common phenomenon that we put a patient on an antidepressant, and oftentimes to keep them going, we put them on a stimulant. Many patients impacted by MS have problems with the down there's, bowel, bladder, and bedroom. And so it's not uncommon that we need to use some form of bladder pill. Sometimes we have to use 2. And we may put them on a medicine to help with sexual function. Pain is extremely common in MS. And it's very common that we may put someone on an anti-pain medicine. I don't mean a narcotic, I mean a neuropathic pain medicine. One that was originally invented probably to treat seizures or depression, but would have central pain properties. And sometimes one is not enough, and we may have 2. Spasticity is very common in MS. And so we may need to use baclofen or maybe Xanaflex. And as you see, as I go through these problems, the number of pills can start to pile up. It's common that a doctor will prescribe a medicine, but it's not common enough that a doctor will take away a medicine. And here's where I need your help. I need you to be an awesome you advocate, and I need you to think about polypharmacy. So if you look at your med list and you're on a bunch of medicines, then I think that that's worth a conversation with your clinician. I would ask you the next time that you see your neurologist, say, hey, I feel like I'm on a lot of medicines. Is there any medicine on this list that we could either get rid of or maybe cut in half? And then go through and say, will you explain to me why I'm on each one of these medicines, and have a conversation? Oftentimes when I do that with a patient, I will discover 1, 2, or 3 medicines that we can cut back or stop. Similarly, I would encourage you, when the doctor prescribes you a new medicine, say, okay, doc, that sounds great, but is there a medicine on the list that I can remove so that I don't go up in the number of pills? A third suggestion is to embrace lifestyle changes, which can ameliorate MS symptoms. Time and time again, when patients clean up their diet and remove processed foods and sugar-laden foods, and they drink more water, guess what? Their bladder works better, their bowels work better, they're less fatigued, they have less spasticity, they think more clearly. For real. Similarly, a commitment to exercise, a commitment to getting proper sleep, these are not small things. And if they can improve symptoms, it might allow us to get rid of some medicines. My name is Aaron Boster, and thank you for learning about polypharmacy and MS today. If you want to up your game and learn more about multiple sclerosis, click the video that's on your screen. In fact, the very best way to help this channel is by watching another video. Until my next Monday morning vid or my next monthly live stream, this is Aaron Boster saying be safe and take care.